Hello and welcome to UHN, Toronto Rehab Lyndhurst Spinal Cord Injury Rehabilitation Center. My name is Brian. I had a spinal cord injury 26 years ago as a result of a diving accident. This video will show you what a typical day might look like for you in rehab. We will introduce you to various therapy areas and the patient care unit and show you people taking part in their therapy. At Lyndhurst, you will be an active member of your rehabilitation team as you work towards transitioning back to the community. You will have access to therapy services 5 days a week. You will work every day with all members of your healthcare team to improve your skills and confidence in managing your condition. When you arrive at Lyndhurst, you will be taken to your room on one of 3 similar units. There are different areas of your health which may be impacted by your spinal cord injury. We call these areas domains of spinal cord injury rehab. There are up to 25 domains you will have the opportunity to work on, depending on your specific needs and function. There are many healthcare professionals who will be a part of your care team working with you on these different domains. At Lyndhurst, rehab is all about teamwork, with you as the leader of the team. We all work together with you and your family to identify priorities and needs to help you become as independent as possible and return to your life in the community. Once you've settled in at Lyndhurst, a typical day of rehab begins as soon as you wake up in the morning. Your rehab nurse is a great educator. They will teach you many things as you participate in your morning and personal care. This includes bowel and bladder care, bathing, dressing, and eating breakfast. Participating in these activities allows you to practice, increase your skills, and become as independent as possible. In addition to active therapy, you may see other team members depending on the type and level of your spinal cord injury. A respiratory therapist may assess your lungs and breathing muscles and provide you with treatments to strengthen your muscles and minimize complications, chest infections, or pneumonia. Neck surgery or spinal cord surgery can impact your breathing, swallowing, and voice. At Lyndhurst, you might work with a speech and language pathologist to help you learn how to eat and drink safely and improve your voice and speech. A physiatrist and family physician work together to diagnose, treat, and help you manage the medical issues caused by your spinal cord injury. A pharmacist will meet with you to review the medications you are taking when you arrive. They will monitor your medications throughout your stay. The pharmacist, together with the nurse, will help you become familiar with your medications to increase your independence. A physiotherapist and sometimes a physiotherapy assistant will help you to work on your goals for improving your independence, physical function, and mobility. You will work with your occupational therapist to learn a variety of self-care skills and how to perform everyday activities like meal preparation, dressing, and bathing. Together, your OT and PT will help you learn new skills and get the right devices for your needs, such as a walker, manual, or power wheelchair. Therapy may take place in main therapy areas, but also outside the hospital as well. You will work with your recreation therapist to assist you with returning to an independent, active, healthy lifestyle. This may include trying new leisure activities and adaptive equipment, leisure education, and community integration. You may also meet with a psychologist who can assess your cognition and emotions that might impact your recovery. Talking about how you and your family are coping with the changes in your life might be helpful after a spinal cord injury. Your social worker and community support worker provides practical assistance to you and your family coping with the effects of spinal cord injury and integration into the community. They assist with future planning and provide information and referrals to resources in the community. You may also have other appointments within the hospital, including urology, skin and wound clinic, and assistive technology services. A spiritual care provider who assists you in exploring your beliefs, values, and emotions as a result of spinal cord injury is available. A research patient liaison will meet with you in your first few days at Lyndhurst. They will let you know about the various research projects you can take part in if you are interested. Lunch is at noon in the dining room. Once you get comfortable using your mobility device, all patients are encouraged to eat their meals in the dining room. Family and friends can join you here. In the afternoon, you may attend therapy sessions with other members of your healthcare team. You are also encouraged to participate in group patient education sessions. These group sessions help connect what you are learning in rehab to living in the community. We encourage all patients to attend all of these sessions during rehab. Your team members will meet with you individually and as a group throughout your stay, providing you with the support and assistance you need to get ready for returning to life back into the community. Spinal Cord Injury Ontario Provincial Office is also located at the Lyndhurst Centre. Spinal Cord Injury Ontario is an ongoing, lifelong resource of and for people with spinal cord injury. They assist people in achieving their goals and rebuilding their lives. They have been offering these services since 1945. They can be a valuable resource for you while you are in the hospital and after you leave. In the evening, you might want to get involved in activities organized by Recreation Therapy or special events hosted by SCI Ontario. This is also a time to visit with your family and friends. At the end of your day, nursing care is available if you require assistance returning to bed. After a busy day, make sure you get enough rest at night for another full day of activity. A typical day at Lyndhurst can be a busy one. You will have a lot to do in rehab. This video showed you the different activities that can happen in a typical day while you are an inpatient at Lyndhurst.